Low-income earners are suffering from food stress, with the weekly food shops swallowing up to 30% of their income. A new report shows that in many cases poorer families can't afford a healthy diet and are more likely to suffer from heart disease and diabetes. Professor John Coveney is the Associate Dean for Public Health at Flinders University in Adelaide.
Food stress is very mortgage stress, actually. Mortgage stress, as you know, is when people have to part with 30% or more of their household income to pay for their mortgage or their rent. Similarly, food stress occurs when people have to pay 30% or more of their household income to eat healthily. And a study that we've conducted across the whole of Adelaide suggests that people on low income would need to spend 30% or more of their income to eat healthily, which compares with more wealthy families, which only need to spend about 9% of their household income to eat healthily. So there's a huge disparity here.
Your study also suggests that low-income families are more likely to eat junk food, but isn't this more expensive than vegetables and cheaper cuts of meat?
When we think about junk food, the thing that jumps to mind is things like, junk food in terms of takeaway food. But if you think more broadly about unhealthy food, things like fatty meats, salty food, highly processed foods, those foods are actually cheaper than leaner meats, low-fat foods, fresh foods. So no, it turns out that healthy food is actually more expensive than less healthy food. And that's not just a finding from our overall study, but that's been shown in many other studies as well. Highly processed food has the convenience of stockpiling and things like that, whereas fresh food, of course, tends to go off, so you don't have that kind of convenience, so it does tend to be more expensive.
Some experts are warning that fresh food prices are going to rise sharply in the future. What needs to be done about this?
It's a real problem that we're having to face. And in the past, when we've tried to think about how to encourage people to eat more healthily, what we've done is to invest a lot of time, energy and money into education programs. And they can work up to a certain extent. They can get people to become more aware about healthy food and ways to prepare food more healthily. But if the cost of food is becoming out of the reach of many groups in the community, especially low-income groups, those programs can only go so far. We have to start thinking about other policy implications that help us engage with the rising price of healthy food.
Professor John Coveney in Adelaide, thank you.
Thank you.